This is the You Can Learn Chinese podcast. For everyone who is learning Chinese and trying to avoid the coronavirus, you came to the right place. I am your host, Jared Turner, longtime resident of China, co-founder of the Mandarin Companion Graded Reader Series, Chinese blogger, and in an unsettling reversal of my teenage years, I am now yelling at my parents not to go out. My co-host is John Pasden, co-founder of Mandarin Companion, founder of All Set Learning, the Chinese grammar wiki, Sinosplice.com, and is worried that he has hypochondria. This is a special episode where we're going to save our usual podcast about learning Chinese for another time. John and I have an insightful talk about the COVID-19 pandemic sweeping the globe with an on-the-ground perspective in China and the U.S. With John based in Shanghai, he will talk about the lockdown over the last 2 months and the current situation now that China is on the tail end of the pandemic. Since I am based in the U.S., I'll be sharing with you what is happening on the ground, including my own son who appears to have come down with the virus and my neighbor who tested positive and at the time of this recording is hospitalized in the ICU in critical condition. This is an episode we never thought we'd record, but let's get to it. Hey guys, this is Jared Turner coming at you live from Utah in the United States.
Hey, and I'm John Pasden. I am in Shanghai, China.
All right, John, we have got quite the episode today. We are going to be talking all about COVID-19 or coronavirus. But before we get into this, we have 3 reviews to talk about. This is great. I'll hit the first one here. This one says, great to hear John back.
Yay.
He says, my experience with Chinese hairdressers is similar to John's, i.e. no matter what you say, you end up with something unexpected. Keep up the good work, guys, and I always get a boost in my language learning after each podcast. That's from James Xiaolang from Great Britain. Thanks, James.
Thanks, James. Okay, and then the next one is from Sam Olay in the U.S. He says, love the book series. I'm about 6 months into my Mandarin journey, and I finally decided it's time to start reading. MC Graded Reader Series is awesome. I've blown through 22 episodes in the last 2 weeks, the podcast, I guess. It'll be a bittersweet day to catch up. So thank you, Sam.
All right, Sam. He's hardcore. 22 episodes. I like it. All right, and our last one is from Mark, 881-81881 from Canada, eh? He says, great stuff. It's great to hear John again. It reminds me of my intermediate Chinese pod days. Ha ha.
All right.
So thanks, Mark. Ba-ba-yi, ba-yi, ba-ba-yi. So appreciate it. Your reviews.
Thanks a lot, Mark.
Okay, guys, we have a special episode here talk about COVID-19 or the coronavirus. And we can offer you guys today a little different perspective because we have John, who's in China, and he's been gone through what China's been going through over the last couple months with the coronavirus there. And it is now really hitting in serious here in the United States and in Europe and other parts of the world. So we're going to kind of hear 2 different perspectives and stories on kind of what's been going on. And also, we're recording this on Thursday, the 19th here in the States. And I'm in Utah. And yesterday, we had an earthquake, John. Can you believe that?
Yeah, I saw that on the news. That's crazy. You guys are okay, though, right? You're not dealing with a house in shambles or anything?
No. I mean, honestly, it woke me up out of bed. I was sleeping. It was happening at like 7:09. And all of a sudden, I thought my wife was like shaking the bed, like out of bed, like pushing the mattress. And I was like, what? And I was like rolling around. And I'm like, and I got up and nope, she was right there. And then it took me about a second to realize, I'm like, that's an earthquake. Holy cow, we just had an earthquake. But I was about 55 miles. I live about 55 miles from the epicenter. It was a 5.7. There was some damage in Salt Lake, but nothing serious. There were some water mains broken. Some people were out of power for a while, but it wasn't like a really destructive earthquake. We had some walls going down. I saw a lot of pictures of some mobile homes that had a lot of damage, but no serious injuries have been reported. And by and large, everyone's okay.
Well, good to hear. Okay, so now back to the virus, Jared. The virus.
Okay. So this coronavirus, we're going to talk about some of what's been going on. But John, you there in Shanghai, you're a little bit on the tail end of this. And you've been going through this for the last couple months. I was in Shanghai in January, and I left like a week before things started getting locked down.
A week, huh?
John, go ahead and tell us the story. What's been going on there in Shanghai with the coronavirus, and like what's been happening?
Okay, so I think we already peaked in terms of new cases in February, but my family and I, we went to Japan for Chinese New Year, and we got back to Shanghai February 10th. So when we came back, It was already all over the news. There were people wearing face masks in the airport and on the plane. We were as well. We were able to get back into the country without any kind of hold up in the airport. They took our temperature. Everything was fine. We took a taxi to get back home. Our apartment complex told us to self-quarantine for 14 days, even though I think at the time it probably wasn't necessary because we came from Japan, which had very few cases at that time. But anyway, we did that. The official Chinese New Year vacation was extended by the Chinese government. So, the kids were home. My wife and I were home. And then when work resumed, we worked from home for 2 weeks. So our company doesn't have too many people, so it wasn't too risky to go back into the office at the end of February, which is what we did. We were all wearing masks, but there was almost no one at the office. Pretty quickly, it became obvious that the masks were not really necessary for the whole time you're at work. And getting into March, still not too many people in the office, but it doesn't feel dangerous at all. There was a time like in the middle of February where you could feel the panic. People were forwarding all kinds of things on WeChat about stories of, deaths and home remedies and all this silly stuff. But that's calm.
Yeah, weren't there like a lot of conspiracy theories that were
there
floating
definitely
around
were.
at that time?
I didn't read everything because, I don't know, I just wasn't that worried about it and I didn't want to spread it. But there's a lot less of that now. But now when you go outside in Shanghai, most people are still wearing masks. I'd say over 90% of the people on the street. The only people not wearing masks are the ones smoking because, of course, that's more important than any virus. And if you want to go into any like mall or restaurant or office building or even an apartment, like a residential complex, you have to be wearing a face mask. And there are also these things now called 随身码. It's a QR code and you have to show it. And if the government has not assessed any kind of risk of being infected on your part, your code will be green. And they don't even need to scan the code. They just need to see that you have a green code and they'll let you in. If they want to, they can scan it, I guess, and see a history of where you've been. It's kind of interesting. But a lot of places aren't even using that. But some buildings are. They can choose to do so if they want to.
Well, John, I've also heard that a lot of places that they've like done forced quarantines at the peak of it. Like you could only leave the apartment like every other day or something.
All right, so I'm in Shanghai and it's nothing like Wuhan, right? But in Shanghai, they did do this thing where like apartment complexes have a pass and like you only get one pass to go out and you can only use it once a day. So the idea is only one person in your family can go out to buy groceries or whatever once a day. And then they also had another color pass. If you need to go to work, you're allowed to go out to go to work. But I'm pretty sure they only were rigidly enforcing that in my complex for about 3 days. And then after that, they just stopped even asking to see it. I remember I forgot to put it in my pocket one time when I went out and they didn't even ask for it. And I just never took it again. But the good thing is that it really doesn't look like such strict measures are necessary right now. It seems to be definitely under control now, even though everyone is still wearing the face masks out on the streets.
So what do you feel like is the general attitude of, I guess, all the citizens right now in Shanghai?
I think everyone is being pretty patient. They're a bit sick of being locked up. A lot of people are still working from home. I think maybe the biggest frustration is from parents. They're just like, when are my kids going to go back to school? I know that for some families where both the parents work, maybe the grandparents don't help too much with the kids. Like it's really hard to figure out how the kids can stay home, do their online lessons, be supervised, and the parents can still work, Aside from that, there's a huge economic impact. Like a lot of companies have seen their business go down to zero, right? I guess the only comfort in that is that everyone's in the same boat.
Yeah, I can talk about that a little bit because as some of you listeners may know, I haven't really talked about this much on the podcast before, but I own a bakery still there in Shanghai. It's Sinus Roll. We're the first cinnamon roll bakery in China. I know it sounds crazy. We do this and I got this bakery thing, but it's something my wife and we started 8 years ago when we were in China. But it's still going, and we were forced to be closed by the government for 5 weeks. And it was nearly crippling. In fact, I have a lot of friends out there in the food and beverage business where this has bankrupted them. They just aren't opening again. It's just not possible because you still have some of these employee costs. You have a whole lot of other costs. The government did institute a directive to all state-owned companies who are landlords that they should be giving their tenants 2 months of free rent. And that was in a lot of provinces did that. They did direct that here in Shanghai. And we are fortunate enough, in some ways, our shop location is at a state-owned property, so we were able to benefit from that, but we still have to pay management fees. Yeah, it's been really rough, and I do have a partner over there who's running things, and we partner with a bagel company over there in China, and without her on the ground, she's done some financial wizardry, which has really kept us afloat. Otherwise, we probably had to close the business. And we're back open just for deliveries, and we're now some small in-store stuff. But it's been really challenging in the F&B business and in the food and beverage there because of the virus. It's having a huge impact over there.
Right. And for me, my main source of business is expats in Shanghai who need personalized Chinese services. And a lot of them, either they were abroad during Chinese New Year and didn't come back, or they left China because they thought it would be safer back in their home country. Now it's not, right? Because of all this mess, wherever they are, they're not doing their Chinese studies. So that definitely affects my business. Fortunately, we're doing a lot of stuff online, so we can keep doing that. We have online products, courses, Chinese grammar wiki, that kind of thing. But yeah, it's kind of rough because our company is not renting from a state-owned enterprise, and we tried to get a break in the rent from our landlord, and they're like, nope, we're not getting a break, so you can't get a break. So yeah, it's tough.
Really tough. And so we do know there's a lot of measures that businesses are taking, and I'll even talk about that, what's kind of going on here in the States in a minute, but it's been just really tough over there. It sounds like, John, just for you, living-wise, just being there under the conditions, and I know also business-wise, it's just been very, very difficult.
Well, I feel like last week was kind of a turning point. Like last week, a bunch of clients started talking to us like, okay, yeah, I think I'm ready to resume my Chinese lessons, either online or in person. So fortunately for us in China, we can feel that things are starting to return to normal. We can see that the virus is contained. I kind of feel like we see an end in sight, but it's hard to say until this whole situation truly reaches a more stable finish, right?
Yeah, and it's kind of tricky too, because one of the numbers that I did see recently was, maybe it wasn't yesterday, it was a couple days ago, there were 21 new infections that they had detected in China, and 20 of them had come from outside of the country. So it's already left, and it's kind of coming back. From what I understand now, they're doing forced quarantine after people get off the plane and come back into China.
Yeah, they escort you to like a government quarantine facility, and you're forced to stay there for 14 days. So I've talked to some people who are considering coming back to China, but now they have to weigh that. Like, do they really want to do that?
Yeah, because it's pretty serious. So, and we don't want that to outbreak again, do we?
All right, Jared, we know what's happening in China. Things are looking okay, pretty stable. How about you? What's going on in Utah with the COVID-19 situation?
Well, I tell you guys, it has been pretty crazy. And right now we're recording on the March 19th. So by the time you hear this, when it goes live on Monday, the situation could be even bigger. But I live in a small town here in Utah called Brigham City. We have population 20,000. And we had our first reported official case in our whole county reported 2 days ago. But that does not reflect the reality of the situation here on the ground. I think in Utah, we have something about 60 official cases. I think now today it's by 80 cases. But once again, this does not reflect the reality. Last week, my son, Miles, came down with all the symptoms. The big things about the virus is that he had like a fever, a persistent fever for days, dry cough. That fever and dry cough are two of the biggest factors. Achy, fatigue, sore throat, headache. And we kept him home from school. In fact, he had us pick him up from school on last week, Wednesday, because he was feeling so bad. So we did. We sent him back to school the next day, and he still wasn't doing well. We thought he was doing well, but then he wasn't. We brought him back home, and it took him over to the weekend before he was getting better. We took him to the doctor on Friday, and they tested him for strep and for flu, and he tested negative. And we're like, well, he's got all the symptoms for COVID-19. And they said, sorry, we won't test him. And at that stage, even last week, they didn't have enough tests to test people. And they said, unless he'd been out of the country, or if he had been in direct contact with someone who's recently been out of the country, we won't test him. And so at that stage, there were something like 15 cases reported. But I'm telling you, John, the thing is that I have been talking with, I have a secretary with my other job here, and it turns out her daughter last week also had all the same symptoms. The week before, all her friends were sick. My mother-in-law 2 weeks ago, all the same things. And one of the big things about this COVID-19 is, if you guys, anyone listening, if you take a deep breath and hold for 10 seconds and you have like discomfort or pain like trying to hold your breath, that is also a big factor because your lungs start to develop like a little bit of the fibrosis in it. So the thing what I started realizing is that this has been going around our community for weeks and nobody realizes it. And, for anyone listening, if you are young or healthy, if you're pretty much under 50 and you're healthy, you don't have a lot to worry about. 4 out of 5 people that get this, they're going to develop symptoms like a cold, or it's going to be a mild cold. For my instance, I think I had a sore throat last week for just kind of like a day. And when my family gets the cough or they get the cold or something, I don't really get it, or I just get a very mild version. But it's that 20% that develop severe symptoms, and part of those develop very severe symptoms. So my neighbor, he's in his 40s, and our sons are good friends. He came down with a serious case, and he's now been in the ICU for 5 days and with blood clots in his lungs, fluid in his lungs, and he is not getting better. It's very severe. He's been in poor health and he has some weight issues. So was much more susceptible. But he had to be admitted to the ICU before they finally tested him. And now he's the first official case, and now everyone's flipping out in our town. But I'm like, guys, it's going around. And in fact, I was just on a call because of one of my positions. I was on a kind of a conference call with the governor here of Utah and a bunch of the health officials. And they're saying, yeah, the big issue here is that we can't test people. In fact, our Utah congressman, it was Ben Adams, I think, McAdams, he tested positive. He was on this call. And he's fine. He's fine. He's going to be okay. But yeah, they're working hard to try to get testing done because all the numbers here are super underrepresented. So I think in our town alone, we probably have hundreds, maybe 1,000, and we got 20,000 people here. So it is spreading like wildfire. And, John, it's interesting to hear your story because there is no lockdown like it is here. Now, they've canceled school, canceled all these events. A lot of restaurants are closed now. But I go to the store and everyone's just out there shopping, pushing carts around. Nobody's wearing masks. On Facebook and stuff, a lot of people are just real cavalier, like, yeah, I'm going to do whatever I want.
Are you saying that everyone in your family got it? Like, did Miles have the most severe symptoms out of everyone?
Yeah, Miles had the most severe symptoms. He's fine now. But my wife, Heather, I think she's coming down with it right now. She's gotten the headaches, tiredness. She's got the cough going on. So my 2 younger ones had dry cough for about 2 days, and then they're fine.
So is Miles okay now?
Yeah, Miles is fine. He's fine. And so some of the stats for you guys on this is for your listeners, that in China, 88% of the deaths from the coronavirus were people over 60. And in Italy, what's going on right now, and oh my gosh, it's just hitting Italy really bad, but the average age of death from this is 70. So one of the big things behind this is that the people who are really hit hard by this are the aged and the people who already have their immunity system compromised.
Yeah, when this thing first hit, I remember thinking, oh, come on, guys. It's just a new form of the flu. Look at the death rates of the flu. It's just the same thing. It's not a big deal. But then it took me a while to remember, my mom is in her 70s. And just because a young person gets it and doesn't have severe symptoms, doesn't mean it's not a big deal because they can transmit it. And old people are dying and more are going to die. So if you really don't care, then think about transmitting to older people, some of whom will die. Can you really say you don't care about that?
Yeah, that's a very good point here. And, the thing is, John, like, I'm okay. And, maybe it might hit me, but I'm pretty certain I'm carrying it. The thing about it is I'm still staying clear of people. I've had to go to the store about a couple of things, but I'm just like, I'm like showered and sanitized up and soaped up and then sanitized, I don't touch my face or anything. Get what I need, and I go through the self-checkout if I've got to get anything, because I do not want to infect anyone. I'm just trying to stay away from anyone. My office where I work, now everyone's just working at home, and I go into the office, I go through the back door up into an office in the back top corner of where we are. We have this whole building there, and so I don't see anyone because I can't work at home with 5 kids. It's crazy.
But do you have any masks?
And that's the thing, is that right now you can't even get any masks. They're sold out. And I live in a small town. I don't even know where to go get that stuff. It's crazy. So one of the things also about the masks are good for you to stop spreading it. It doesn't really block out the virus getting to you, but if you have it, it can help you, you sneezing, talking, whatever, and kind of distributing that out.
That's the thing that's kind of silly, though. I know that in Western countries, the US, Australia, whatever, people don't want to wear the masks. But, you have this for like 2 weeks without any symptoms. And sure, I'll wear a mask if I have it, but by the time you have symptoms, you've been spreading it for 2 weeks without a mask. So I totally support the Chinese, initiative to make everyone wear masks because you don't know who's carrying it until they develop symptoms.
And you're totally right, John. And that's really the thing about it. Unfortunately, I've been involved in a number of Facebook maybe discussions, slight arguments, at time, and just, people posting about this stuff. And sometimes there's people making comments like, you're not going to control me. You can't tell me what to do because Utah just banned gatherings over 10 people. It's like now a misdemeanor gathering over 10 people. And I'm talking to this guy, hey, it's not about you. This guy looks like he's in his 30s and he looks, fit and healthy. And I'm like, it's not you. That's not who we're worried about. If you get it, you're just going to get like a cold. It's not going to hit you hard. But, when I start sharing, personal stories of people who have, I know this guy, he's my neighbor. He's a friend of mine. He's in the ICU 5 days. And then anyone listening here, who might be in Italy, I'm sure you know somebody who's either seriously ill from this or possibly has passed away. Here in the United States, it's just a matter of time. I had another friend who was very skeptical about posting some conspiracy theory. And I'm like, hey, once again, you're going to start seeing in the next month, people your fathers or your grandparents' age are going to be really sick or hospitalized. And he actually had heart issues. And people who have cardiovascular or heart issues are a much higher risk. And I said, hey, you better hope you don't get it because you've been in the hospitals last year for heart issues. If you get it, it could hit you really bad. And so we got to be careful here. It's not for all the healthy people. It's the people who have their immunity compromised and the people who are elderly. And that's what we're really looking out for.
Right. And I realize that the whole mask issue is kind of a moot point, like in the U.S. when no one can get masks. But I mean, you can reduce contact. You can stay home as much as possible and don't just be like, oh, I'm not going to let this affect me.
That's right. And there's just a little bit of information about this too, as, some people said, well, look at the flu killed more people and this hasn't killed enough, Well, yeah, so far, but we haven't really seen the outbreak of this. And one of the things is that the flu, here's some interesting numbers. There's something called the reproductive factor of a virus. And the flu, if one person gets it, they're estimated to infect approximately 1.3 other people. But for the coronavirus, it's estimated to be about 3 times as many people. So for every one person infected, they're going to infect maybe 2 to 4 other people. That alone, it's much more contagious and it's much more likely to spread much, much faster.
Jared, I know this is only speculation on your part, but I just want to ask what you think. So your son was going to school with symptoms of the virus. Do you think that that's how your whole family got infected through school? Like your kids at school getting it from other kids?
Yeah, I think so. I have no doubt. And I'm sure that he's been carrying it. And I know my boy, he's 12-year-old, sometimes picking his nose and sneezing and wiping his face. I'm certain he's infected other students.
If the school's just recently closed, I think it's pretty safe to say that most of the kids in the school system were all infected, no?
Well, I can't say that everyone, and I doubt everyone is, but I have no doubt that there is a good portion that are.
So maybe some of those loner kids with poor social skills got out without getting infected. Huh?
Who knows, right? But the bottom line is that I have no doubt this has been going around at least our community for weeks. So, within our state, Utah has about 3-4 million, but I have no doubt that there's tens of thousands of infections already. I have a friend who is a physician's assistant in Iowa in the Quad Cities area. And already he's told me, he says they've canceled like all elective surgeries. They've put off everything. They're already like trying to clear out the hospital because they're already having these patients start to come in. And they're anticipating within the next couple of weeks a huge influx of patients. And he's obviously worried about being able to take care of them all. Respirators is a big problem because the patients who are in critical condition, they need respirators, they need oxygen. So that's one of the reasons why, in the States and other areas are saying, social distancing, because let's stop how rapid this is spreading. People are still going to get infected, but if we spread it out over time, the medical system will be able to at least treat these people. Whereas we have the situation in Italy right now. I've been reading interesting stories of that. There are people in towns and areas where the person has died in the home because there was no room to care for them in the hospital, and there's still a dead person in that person's house, but they won't even let the morticians come take care of them or anything because they don't want it to spread. And it's like they've got like a dead body in the house, and it's like nobody's taking care of it. It's a really sad situation when you had a huge peak and the system can't take care of people.
Yeah, and that's what happened in Wuhan, right? There were so many people in the hospitals that they couldn't admit new patients no matter what they had because they were just overwhelmed.
Yeah, that's right. And they built, 2 hospitals in a matter of a week?
Yeah, it's crazy.
If there's one country that can do that, it's China, that's for sure. I don't want to be out here and like scare people, but it's really just take this seriously. Even if you're feeling fine, even if you've never got it, be careful because you could be carrying it and you don't know. And I know most of our listeners are, under 50. I've seen some of our stats, but, you probably have parents or grandparents, or somebody who could be at risk if they get this virus. It could really seriously affect them.
And even if you only hang out with young people, some of those young people you hang out with do have contact with elderly people. So, the best thing to do is just retract, catch up on that reading.
Catch up on that learning Chinese, right?
Yeah, even better.
Oh, and the last thing too, John, is that the impact it's going to have on the economy worldwide is probably going to be significant. I work with businesses and small business owners on a consulting basis here in the States, just telling everyone, hey, just try to right now cut your expenses, anticipate that this is not going to go away soon. And John, I think it's important to know, like, how long has it been in Shanghai since they started this lockdown?
I'm not sure exactly how you define it, but I feel like it began right around February 5th, 6th, 7th, something like that.
Okay, so we're 7-8 weeks into that, roughly. And they've taken very serious measures to control this, right?
Yeah, for sure.
Now, everyone else listening here who is not in China, think about the measures that your government or your country is taking. And I guarantee they're not as that severe as what they've been doing in China. And I think just from that alone, you can see that this is not going to blow over in 2 weeks or 3 weeks. It's going to take months. I know the president, he said anticipating July or August, and I don't doubt that. So just letting you guys know that, take care of your own measures and make sure your own financial house is in order because it's going to impact a lot of people with jobs, with income. If you have a big car payment, maybe sell that car now, and get something a little bit cheaper. Just try to cut your debts and weather the storm. It will pass. And John, what have you heard about the end game on this virus? How do you think this is all going to end?
I haven't been reading a lot about that. I'm just kind of taking one day at a time. Back in February, I canceled my summer vacation plans. At the time, I wasn't thinking about how the virus is going to spread throughout the world. I was thinking more about, well, if my kids haven't been going back to school for all of February and they're not going to start online lessons until March, then it's such a total Chinese thing to do to take away summer vacation and extend the school year into the summer. Yeah, I'm only kind of thinking through the summer at this point. Have you read much about the endgame?
I have some interesting things from John Hopkins and out from Stanford. It's hard to know. A few factors depend on what is the immunity of people after they get the virus. If people could become immune to it after, that can actually be a good thing. But what they're kind of thinking might be is there might be partial immunity. So what might happen here is, for example, in the United States, they're estimating a 30 to 70% infection rate after this all passes through. I mean, we'll see what actually shakes out, but it'll come back again in another wave. But more of the population will be resistant to the virus. And so it'll probably go in some waves over the years, and eventually it'll come to a point where it might be just like another cold. Just be like the flu. Like the flu goes around every season. And so this COVID-19 might turn into something like that, just another flu. And but it won't hit everyone as bad because there's now partial immunity among the population.
Right. Well, strap yourselves in, folks. Social distancing. Learn some Chinese at home.
That's right. And so next episode, we're going to get back to talking about, learning Chinese again. But for everyone who's hunkering down, this is going to be an excellent time to get some graded readers. And in fact, we now have a word from our sponsor.
And our sponsor is All Set Learning. Woohoo! So today, I want to mention to everybody that All Set Learning has a bunch of great online courses. And among those are 3 courses which are specifically tailored to the Mandarin Companion graded readers. So we got one for The Secret Garden, one for The Ransom of Red Chief, and one for Sherlock Holmes and the Case of the Curly-Haired Company. So if you've read the books, then of course it's good input. Everybody knows that. But if you haven't ever talked about the book, then you don't have the same mastery over the material that you'll get through that practice. So the whole point of the course is you've read the books, you enjoyed them, and now you get to talk with a native speaker, Chinese teacher, one-on-one, online. It's not a video course. You get to talk about what you liked, what you think. You get to practice the vocabulary you learned for the first time. Everyone who's tried it has really enjoyed it and really learned a lot from it.
I got to tell everyone, like, this is awesome because I've been doing this type of stuff with classes, working with teachers in dual immersion schools and classrooms and helping them pretty much implement this type of thing. And man, I can't tell you the huge progress that I see students make when they're using the book like this and using it as a basis of discussion and doing some writing. So what John's developed here is super awesome. So if you really want like a boost, you really want to like make some serious progress and get the most out of reading and graded readers, this is something you definitely want to take a look at.
Right. So we'll put a link to this in this episode's notes, but it's allsetlearning.com/courses.
And just so you guys know, the All Set Learning is John's business. We always talk about it, but All Set Learning is his language consultancy.
Right. So we're very much focused on individual learners and personalizing their studies so they can get the most out of their Chinese progress.
All right. Well, go check it out today, right now.
Thanks, guys.
Okay. Now we have Rants and Raves. Now, I feel like this whole episode so far has been kind of one big rant. So, John, hopefully you've got a rave for us. What do you got?
Well, I kind of wanted to keep it in theme. So I just wanted to give a little bit of rave for the Chinese government because the Chinese government gets a lot of flack for being, authoritarian regime or whatever. But some of the stuff they've done with this whole academic situation has been really cool, really amazing, inspiring. It kind of reminds us that different models of government have their pros and cons. I really was impressed by these QR codes that I see around town. Like if you ride the subway in Shanghai, there's a QR code in every car, and it's different for every car. And by scanning that QR code, you're telling the government that this phone number was on this train car at this time. And then if that train car turns out to be linked to any cases of COVID-19, they'll actually inform you. And then they also have these other things called the Sui Shen Ma, which is this personal health code. I'm pretty sure it's all linked into the same data. I don't know all the particulars, but it's just really cool linking of data. Now, of course, the naysayers will say, "Oh, they're tracking your every move," and blah blah blah. Yeah, that is true too. But
isn't that the point?
It doesn't help you a lot if you end up dead, right? Like being free doesn't help if you're dead. So, yeah, it's kind of tricky. I understand both viewpoints, but when you're in a very thickly populated city, it's kind of nice to have some extra measures in place to track the spread of the virus and try to keep as many people safe as possible.
Well, that's really cool, man. It's amazing what it can do with technology. All right, I also have a rave, John, and my rave goes out to all of the school teachers here in America right now. We work in education, and with school being canceled all over the United States, and I know different countries and different parts of the world, I have to give a huge rave to all these teachers who have been through Herculean efforts to get their courses online in a matter of days. I have been impressed, like what they've done. And, I have 4 kids in school here, and just all of them are now on the computer and doing their classroom assignments. And it's opened up a kind of a new dimension on, what we can do with learning and distance learning. And my wife's now homeschooling the kids with, in conjunction with all this stuff. So huge props to all the teachers out there, whatever you're teaching, who have had to basically a moment's notice move everything that you're doing online. It's been quite amazing. These guys are real heroes.
Yeah, totally. And the same goes for Chinese teachers over here too. I remember a while ago, people were saying that, China has forced upon its entire population the world's largest online learning experiment. And that experiment has extended throughout the whole world now. In some ways, it's good for online learning, right? And thank you to all the people who have had to do extra work to make that possible for everybody else.
So, yeah, we're all in the same boat here, guys. I mean, it's one big planet, and we're all kind of pulling together. So we can do this. You got this.
Stay safe, everybody. Stay home.
加油. 坚持. You have been listening to the You Can Learn Chinese podcast. Help us not spread the virus by staying away from your friends, classmates, teachers, cousins, postmen, cashier, blood donor, homeschooler, and that one guy named Brady. You can subscribe on iTunes or wherever you get your podcasts. And please write us a review so we know how we're doing. You can find us on Facebook and at mandarincompanion.com. Apologies to John Cena. We're just practicing good social distancing. The You Can Learn Chinese podcast is produced by myself, Jared Turner, and our editor is James Harper. And I'd like to thank my co-host, the man, the myth, the legend, John Pazzo. See you next time.